Good morning to everybody who is joining or who has joined. We are going to wait a couple minutes to let more folks join and anticipate starting around 10:03. Just a reminder that to folks that are joining, we are pausing a couple minutes to let more folks join and anticipate starting around 10:03. Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care and Fiscal and Administrative Services divisions. This webinar is being held on August 28th, 2020, and is scheduled to run from 10 a.m. until 11 a.m. Thank you all again, and good morning again for taking time to join us this morning for this webinar. My name is Stephen Profiter, and I am the Director of the Early Learning and Care Division at the California Department of Education. This is our third webinar in this series, which is aimed to provide the most up-to-date information and guidance available. I would like to start by quickly saying that, as you know, things are ever changing, and we are doing our best to provide operational guidance out to all of you. In addition to the shifting dynamics due to COVID-19, we continue to be confronted with many wildfires that threaten the lives and livelihoods of so many children and families. These fires and emergency conditions too often result in long-term recovery efforts. Some natural events may have rendered centers, preschools, and providers unable to offer services, and we'll continue to work to provide guidance to address issues around these kinds of issues. I'd also like to take a moment here to recognize today as the 57th anniversary of the March on Washington to address civil and human rights issues. And I'd also like to acknowledge that we, again, were confronted this week with two senseless shooting events in Kenosha, Wisconsin. First, Jacob Blake was shot multiple times in the back, and then protesters were shot and killed in days that followed. These events are sadly an enduring reminder of the racial injustices that remain and provide a stark reminder that we have so much work to do. I'm reminded that too often people of color are not afforded the same protections their white counterparts are. It is for this and other reasons why we say, and will continue to say, Black Lives Matter until it is the universal truth that it should be. And so, returning to the webinar, we have accumulated questions and concerns from many of you through the emergency email address stakeholder group meetings, contacts with ELCD staff members, and Q&As from last week's webinar. We've heard feedback from some attendees to the previous webinars, and because it takes a team effort to conduct these webinars, we want you to know that our panelists have many monitors with screens open simultaneously in order to capture your questions. This should not be perceived in any way as not being engaged or being preoccupied with other things. Nothing is more important here than providing you all with up-to-date guidance. We do appreciate the continued communication with you all and hope that you'll continue to bring your questions and concerns forward. I want to stop here and thank the team who have been working tirelessly on many fronts to craft guidance and support programs. And with that, I will turn it over to the Early Learning and Care Division's Associate Director, Erica Otiono, for some additional remarks.
Thank you, Stephen. I echo everything that you have said. This is Erica Otiono. I'm the Associate Director. I oversee directly the Office called Program Quality Implementation, PQI. For that office, we oversee the California Department of Education, CDE's Early Head Start program. We conduct all reviews for all contract types. We coordinate and provide training and technical assistance to contractors, and we also coordinate the implementation of program quality activities. For today, we do not have specific updates for you, but next week, rest assured, we will provide you with some updates. We are working with stakeholders to really hone down and firm some program activities that will occur this fiscal year. So we are working with stakeholders. We appreciate all you have been doing and continue to do for your staff, providers, children, and families in your community. For programs that are currently open and serving children, for those who plan to open, for those who never closed, I say thank you. And for those programs who reach out remotely to children and families who choose to shelter and continue to shelter in, I also say thank you. Please remember, you always have your program regional consultants to reach out to. They are ready anytime via email to respond to your questions, provide technical assistance, and resources for you. Finally, please continue to keep safe and healthy as we do this work together. And now, on to Virginia, our policy administrator.
Good morning, everyone. So glad that you're able to join our webinar today. As Erica mentioned, my name is Virginia Castor-Early. I'm the administrator of the Early Learning and Care Division Policy Office. So that means that my team is lead on all the different pieces of guidance that's underway and also working with the governor and the administration on things like budget trailer bill and so forth. So I'll talk later in our webinar to give you an update on some recently released guidance we had, some upcoming guidance we have, and some, just a quick summary of trailer bill. But before I go, I just want to clarify, and Alana will describe this more, but I see that a lot of people are putting questions in the chat. So we really, really would like to see your questions in the Q&A feature. Our team is working behind the scenes to answer them, and Alana will describe that in more detail. But if you've put anything that's a question in the chat feature, please go in, copy and paste that question and put it over in the Q&A function. So the chat, we really just enable that so that you could say hi to each other, so that you feel like, we're connecting, we could say hi, thanks. And it also, we want to have it enabled so that we can share links. So for example, when we're talking about trailer bill later, we can put the link to you in it. So really, we would really prefer to not have any questions to us in the chat feature because it just doesn't enable us on the back end to track them as well. So, if there's anything that's sort of, you want to say hi, thanks, that kind of thing, feel free to put that in the chat. But everything that's a question or some type of comment that you might want us to respond to it on this webinar, please, please, please go put it in the Q&A feature, even if you've already put it in the chat. So at this point, I'll turn it over to Alana. Sorry, Alana, I stole some of your talking points, but wanted to make sure that folks weren't having to create more work for themselves as we go through. So over to you, Alana.
Oh, nothing was stolen, Virginia. We're all a team. So, and we're just very thankful that everybody is so engaged and participating. And we're very thankful that you're all here and coming to us on our webinar. As Virginia said, my name is Alana Andrade. I'm a consultant in the policy office, and I'll be helping to moderate this webinar and helping, as Virginia was talking about, behind the scenes. Answering today are Cassandra Lewis, Richard Miller, Yura Zhang, and Christina Toomey from the Program Quality Implementation Office, and Danielle Cinceneros from the Policy Office, as well as Andrea Johnson and Alan Lynch from the CDNFS division. And also joining us today are Robert Holm and Carly, actually it's just Robert today, Robert Holm from the Child Development Management Information Systems, or CDMIS. As we continue the webinar, please mute your microphone and continue to mute your microphone throughout the whole presentation. If other questions arise that aren't answered during this hour, please submit them to ELCD's emergency inbox at elcdemergency@cda.ca.gov. It's also important to note that we at CDE will be releasing e-blasts and emails and FAQs and management bulletins to the field as soon as they are made available. At any time during this webinar, you can write and send your questions using the Q&A features, as many of you have already been doing. We will save answering questions aloud from the Q&A until the end of the presentation. If we're unable to answer any of those questions, all those questions will still be captured. One other thing to note as we go through, last week we probably showed off photos from Cadango, and here they are again. All these children in the photos that you will see are children from our programs. The ones on this slide are from Cadango. And now I'm going to ask Stephen to come back and talk to us about the agenda.
Thank you, Alana. So
just real quick, before you go, Steve, I'm still seeing questions put in the chat function. Please do not put questions in the chat function. Please put them in the Q&A. And I think maybe for future webinars, we'll disable your ability to put questions in the chat function. This was an experiment. So just, if you've put something in the chat, please copy and paste, put it in the Q&A. Thank you.
Thanks, Virginia. So by way of an overview of our work, our staff have been working with the legislature and administration to help influence the decisions made in the budget, to provide some technical assistance to them as they work on the budget, and then also to elevate issues from all of you that have emerged since the budget was signed at the end of June. At the same time, we've been working on developing guidance that will continue to be released. Since the webinar last Friday, the revised August budget trailer bill, it's still funny to say August budget trailer bill, but it went into print, and we're currently waiting for the legislature to pass it and for the governor to sign it. Based on legislative laws around this, the governor has until the end of September to sign that budget trailer bill, which is also known as Senate Bill 820, Senate Bill 820. Today we want to provide you with the status update of ongoing CDE guidance work, both in terms of what's new and what's ahead, so you know where everything is. Additionally, we'll be covering fiscal updates along with reporting information from the Child Development Management Information System. And finally, at the end, we will take questions as we have in previous webinars. We'll start with some questions that have come into our ELCD emergency email box. We won't be able to get through everything, but we will do our best to address as much as we can in real time. You may also use, as Alana mentioned and as Virginia reaffirmed, the Q&A function in Zoom to put your questions in. We're going to do our absolute best to get to as many questions as possible during this webinar, but whatever questions we don't get to, we will take back to address in FAQs on our website. And before I turn it over to Virginia to talk about guidance work, I'd also like to acknowledge the cohort guidance released by the California Department of Public Health earlier this week. We've heard some concerns from many of you related to the application of the guidance, and we're working with our legal team on the applicability issues. It will be incorporated into an upcoming management bulletin, and we'll likely release something in an email to subscribers of our distribution list as we work through the applicability issues. We know there's issues in here, not just related in the effect around having 2 adults in the cohort, and then the impact that has on serving infants and toddlers, as well as addressing requirements around staff lunch and break times. So we are, we know there's some language in there about not superseding other guidance that's out there. So we're working on that, and we will send something out as soon as possible. And now I'll turn it over to Virginia to discuss the ongoing CDE guidance work and key issues of concern.
Yes, thanks, Steve. So this slide sort of walks folks through our ongoing CDE guidance work. So we really have a number of different things. The first category is our recently released guidance that we just want to talk you through at a high level and remind you that that exists. And then some pending guidance that we're working on. I'm already seeing a lot of questions in the chat about this. So I'll give you sort of a sense of where everything's at. And then, of course, as more questions come in, just, if I answered your question about timing and you have other questions, just again, feel free to keep putting those in the Q&A function of Zoom. So in terms of recently released guidance, we sent out an email to contractors through our, really to subscribers of our Early Learning and Care Division email list. So that email talks through our requirements for reopening and reimbursement for direct services contractors. Again, we sent that email on August 21st, 2020. So this provides guidance. It discussed requirements for reopening that were in Senate Bill 98, that's the June trailer bill, and pointed out a sort of intermediate step that programs that are operating on the campuses of local educational agencies, so this could be a community-based organization operating on an LEA campus, or it could be an LEA itself, those steps that they should take pending the passage of the trailer bill, which I'll talk about more on the next slide. So it details that for our direct contract programs, they're to be reimbursed at the lesser of 100% of their MRA or net reimbursable program costs when the program is either open by September 8th or within 21 calendar days from the start of their calendar, or not physically open by these dates due to a written state or local public health order or guidance related to early learning and care. So, the contractors must physically reopen by those dates unless there is this written state or local public health order or guidance to receive full reimbursement, and any future days of closure related to COVID after that opening, and if they're due to, say, a COVID public health order or something like that, then they could physically close and continue to be reimbursed at the lesser of 100% of their MRA or net reimbursable program costs. So a couple of things. A reminder that in instances where, and I'm seeing somebody, in the chat is asking a question, and please remember not to call you out, but also remember to put your questions in the Q&A. The date was physically open by September 8th or within 21 calendar days from the start of the calendar. So, so this is, if the program is unable to open within 21 calendar days of the start of their program calendar, the program can submit a revised program calendar and program narrative change that changes the date, as long as it's before September 8th, and that the program would reopen before September 8th. So these should be submitted to your Program Quality Implementation Regional Consultant. So additionally, the email basically shares that there were ongoing discussions with the legislature and the administration specific to what happens for programs operating on LEA campuses. So for those programs, the guidance shares that they can continue to stay closed. And once Senate Bill 820 passes, which I'll talk about in a minute, we'll issue more guidance specific to programs operating on LEA campuses. But for now, they can close and be reimbursed at 100% of MRA or net reimbursable program costs. The email also sort of walks through a number of different scenarios about reimbursement in different circumstances. For example, what happens if a program opens up after September 8th, but their closure wasn't due to a public health order or guidance? What happens there? I'm not going to walk through all of them here on the call, but if you have questions, again, submit them in the Q&A function of the Zoom call. So just the last piece on this, that contractors that are operating multiple sites and classrooms may consolidate those sites and classrooms if demand is low at some of their sites or classrooms, as long as their alternate sites or classrooms are reasonably accessible for enrolled families. If there's a situation where all sites or classrooms are only providing distance learning, this does not count as being physically open. Contractors must submit a plan to us for distance learning. We'll be providing more detail on that later. Until that detail comes out, follow your existing distance learning plan. But there is a requirement that if programs are being closed and funded to be operational, that, for example, because there's been a public health order, or maybe some families are attending in person and some aren't, there must be distance learning provided. So pending guidance, family fees, well, I'll talk about this more on the next slide, but we're in the final stages of an email that will give guidance on, our last email on family fees said, we'll give you more guidance on reimbursement for July and August fees soon. And so that will just sort of close the loop on that and provide the final piece of guidance there. And it'll also have some pieces about how to respond to future changes in law and prepare for those. We're also working on a management bulletin now specific to distance learning. So that's going to include pieces around the distance learning requirements, the distance learning plan, how to submit it, and we'll also have some guidance around nutrition because we know that's been a hot topic among many of you. Until then, as I said, continue to use your existing distance learning plan. We're also, we're also hard at work on guidance related to emergency closures for reasons other than COVID-19. So we know that there are many agencies that are impacted by the hundreds of fires raging throughout the state. We're diligently working to ensure that children, families, and agencies are safe and supported. We're working on updating Management Bulletin 1009 to address non-COVID emergencies. And so this is just being updated for the current fiscal year only to allow the directives we have to align with other directives we're having for COVID-related emergency closures. Because those other directives no longer consider child days of enrollment as a factor for reimbursement. So it would be a little confusing to rely on 1009 at this point. We hope to have updated directives to you soon on that. in terms of our COVID-19 guidance to California Resource and Referral Programs and Local Planning Council, this management bulletin continues to be in our final stages of review, and we're hoping that it will move forward in the next few weeks. We've just been having to prioritize some of the ones like family fees, where folks really need to have information on that one as soon as possible. And then finally, we want to announce that we're doing a webinar on procurement guidance September 2nd at 1 p.m. So you can block that on your calendars. We'll also be sending out an email to our distribution list with that announcement, information on how to join, but we wanted to have you all be the first to know about this, this opportunity for guidance. So next slide. Awesome. So this slide walks through some of the trailer bill components. Senate Bill 820 was put into print on Monday or Tuesday. I think it was put into print on Monday and amended on Tuesday. This bill is sort of changing some key elements of the June budget agreement, and it does affect our programs. So we released an email to subscribers of our email distribution list on Tuesday of this week, which included information on what's in the bill. So even though this bill is in print, it does not become law until the legislature votes on it and passes it, and the governor signs it. And so just wanted to share in that email, and we wanted to share today with you some information on what's coming as long as the current agreement stays in effect. But we also want you to know that it's not the law, and we can't we can't legally tell all of you to do something until it is the law, except where we have some existing authority. And so just please keep that in mind as I'm sharing everything that I'm about to go through. So Section 3 of this bill, of Senate Bill 820, and can someone on the CDE team put the link to the bill in the chat so people can find it? As a reminder, don't ask questions in the chat, but you can go to the chat and get the link that someone will put there. Or if someone else finds it first, feel free to share the link. So this Section 3 of this bill talks through requirements for reopening and reimbursement for direct services contractors. So I already talked through what those are for programs that are not operating on LEA campuses. And what the legislature has done is they've rethought through what the rules are for programs operating on LEA campuses. And so it's amending those. And specifically, our understanding is that there were many school districts where the school districts weren't allowing the programs to open, and the programs were not going to be reimbursed through no fault of their own. And so those are some of the concerns that our understanding is motivated the legislature to make this change. So follow our most recent email on Friday for now. That's the directive that we're giving. But once this bill passes and is signed, it will add language to education code that basically allows programs operating on the campus of an LEA where the LEA itself is closed due to local or state guidance for K-12 or community colleges or things like that. It allows early learning and care programs on those campuses to be closed as well and funded to be operational if the LEA is basically requiring the early learning and care program to also close. So additionally, the bill would require that the governing board or body of the LEA would have to discuss the closure in a public hearing and prepare a plan for safe reopening, which would need to be no later than when the LEA campus is open for in-person instruction, but could be before. So as soon as safely possible. That's the language in the bill. The public hearing and the plan would not need to be completed before the program closes, but must be completed in a reasonable time frame. So that's the first bullet. The second bullet where there are changes is around supports for voucher providers. So again, this isn't the law yet because the bill hasn't been signed by the governor and passed by the legislature. But if it were to pass in its current form, this bill would allow voucher providers, so Stage 2 CalWORK, Stage 3 CalWORK, California Alternative Payment Program, the Migrant Alternative Payment Program, to receive up to 14 paid non-operational days in addition to the 10 that are currently specified in Title V. So, and the provider, according to the language, could use these days anytime between September 1st and June 30th. So in order to finance the cost of these 14 non-operational days, the legislature redirected funds that were originally allocated for some stipends to alternative payment providers for this purpose. And we'll talk more about that later, but just there used to be, I think, 60-something million available for stipends. Now there's 30-something million available for stipends, and the other money is going to support the cost of dual provider payments if there's a period where the child needs to find an alternate care provider while their original provider is closed. So the next item that this trailer bill addresses is around family fees. So, and we know that so many of you have questions, and there's urgent need on this, and I think we're kind of in a bind because this isn't passed yet, and we know that September, and it will influence September fees. So as I mentioned, we're working on an email that will provide all the guidance and clarity we can as soon as possible before the bill is actually signed, and we'll need to follow that up with something after the bill is signed. We're hoping that we can get that email blast out today or very soon after today. So we already did send this, and just as a reminder, if you're forgetting, we did send an email to subscribers on July 28th that mentioned that family fees were waived for July and August. So when Senate Bill 820 is passed and signed, it'll just sort of confirm and clarify, yes, family fees were waived for July and August, because that was done by CDE with some very temporary authority from the superintendent. So this sort of gives CDE, confirms the CDE decision there. It will also share that families who are disenrolled, either voluntarily or involuntarily due to family fees, may re-enroll, subject to programs having available space for them without needing to submit further eligibility documentation. It also has some language around how family fees will be waived for families between September of this year, so this coming month, and June 2021, for families where all the children in the family that receive services are remaining at home either for distance learning or due to the family sheltering in place. And sheltering in place is just where the family decides to shelter in place for whatever reason due to COVID pandemic, or it could be due to a local or state public health order that's specifically requiring the family to shelter in place. Another thing to point out is that the bill says that if additional federal funds are not received, child care providers will have to absorb the cost of the fee. Until further guidance is released, please continue to move forward with the guidance we issued on July 28th. As I mentioned, this one is really complicated because we know that fees are paid in advance of services, but families aren't necessarily going to know when they're going to be sheltering in place or doing distance learning in advance of the month. And so this one has been a little thorny for CDE to think through. So thank you for your patience with us, and for those of you that have been thought partners as we've had to navigate this. And as I mentioned, we're hoping to get something out tonight or very soon after today. The next item that's addressed in trailer bill is parent signatures. So we sent out an email to subscribers of our distribution list on August 7th that indicate that contractors should not withhold reimbursement to providers because of attendance records not having the parent signatures if the parent wasn't able to sign because of COVID. So we did that again based on some temporary authority that the superintendent has. But when SB 820 is passed and signed, it would allow providers who attempted to do that. It would allow this to happen for the entire fiscal year, so not for a time-limited period. And the language would require providers who submit attendance records or invoices without a parent signature to document their attempts. We have received feedback from our current guidance that maybe there are ways we can make it a little easier. So we're relooking as we work on a final management bulletin for when the bill passes. We're taking another look at what types of documentation are we going to require. If you have any feedback on that, feel free to send it to elcdemergency@cde.ca.gov. The final piece here is that we know that many of you, we know and the legislature knows that many of you are in situations where due to COVID-19, there's a need to be addressing priorities for in-person services. And so the bill directs CDE to give guidance to all of you about what needs to happen in terms of prioritizing families for in-person services if there's a COVID-related group size or ratio that would prevent all enrolled children from attending in person. So there are a couple of things that are spelled out in the trailer bill that we're supposed to consider. One of them is the disenrollment priorities found in Education Code 8263.3. And the other piece is whether parents work outside the home. So we're working on incorporating that into our series of August budget management bulletins that will come out after the SB 80 is signed. And just it finally says that if a child isn't receiving in-person services because of a ratio or something like that, that they need to be provided distance learning services. So I think I pretty much said this at this point, but just to reiterate, this bill is not yet law. As soon as it becomes, we're working internally at CDE to have guidance that's ready to go in management bulletin form as soon as it does become law. You can expect intermediate information from us on family fees, but just know we want to alert you of what's coming, but we also can't direct you to do it until it's law. So that sums up some of the pieces we've been working on. And so next is an update from our analyst, Rob Hom, from our Child Development Management Information System, CDMIS.
Thank you, Virginia. And good morning, everyone. Like Virginia said, my name is Rob. I'm one of the analysts within this is a mouthful, the Child Development Management Information System, or CDMIS team. This morning, I'd like to go over how your agency should be reporting families and children on the CDMIS's CDD 801A report in the case that your agency's childcare sites are closed due to COVID-19. Let me first start by saying if your agency's childcare sites remain open and in-person services to your families and children are still being provided, we're going to ask that you continue to report children on the 801A report as you have been. So in other words, there's going to be no changes needed to how you would report those families and children based on your past reporting practices. Now, conversely, let's say your agency's childcare site or sites are closed due to COVID-19, but the families and children are receiving distance learning services. We'll ask that you report the enrolled families on the 801A report that received those distance learning services. Now, just for clarification purposes here, let me define what we call or what we would title an enrolled family on the 801A report. And that definition would be an enrolled family would be defined as a family that is both enrolled and would have attended the program if the child care site or sites had not been closed due to COVID-19. Lastly, if your agency has both distance learning services as well as in-person services being provided, please report families based on the aforementioned guidance. But if you do have any questions, whether they're COVID related or they're not COVID related, please send us an email to the cdmis@cde.ca.gov. I'm going to actually put that in the chat box here. And we'll be able to touch base with you to get your questions answered. Again, it's the cdmis@cde.ca.gov inbox that you would send those emails to. With that said, I'm going to turn it over to Andrea from CDNFS, who will then provide you with some fiscal updates.
Thank you, Rob. This is Andrea Johnson. I am the manager overseeing the Child Development and Nutrition Fiscal Services Office. We went over this how to report attendance on the CDNFS report form last week, but we wanted to put a side-by-side so that we were clear the differences in how to report in CDMIS and how to report on your CDNFS or CDMIS and the CDNFS report forms. So you will report the days of attendance for any child receiving in-person services on your report form, your fiscal and attendance report form. But different from the 801 reporting in CDMIS, you will not report attendance for those children receiving distance learning. So if they are receiving distance learning, you do not report them on the CDNFS fiscal and attendance report form. We did get a question in the chat just a bit ago about, I believe the scenario was for an LEA that has been closed between the period July 1 and September 7th. So in that case, you would report the enrollment for those children, but you would have 0 attendance on your fiscal and attendance report form because no children were physically in attendance. So what that's going to look like on your calculation worksheet, when you get a calculation worksheet, is you're going to see 0% in attendance. But a reminder that that is not incorporated this year into your earnings calculation. Because as Virginia mentioned a little bit earlier, that the calculation will be based off your total contract MRA and your expenses, your reimbursable expenses that are attributed to the program. So we're not taking enrollment or attendance into account when we're calculating reimbursement for this year, 2021. So I did want to mention that. A question that we received last week from last week's webinar that I'd like to take an opportunity to answer now too is for excused attendance. So if you have, like, how do I report a child that I'm expected to attend? I'm expecting them to attend, but they don't attend. You'll still follow your regular attendance policies. So any child that would call in sick, that's an excused absence, excuse me. So they would be reported as a day of attendance. If they're sheltering in place because of a positive case, for example, that could be a family emergency. So that also would be an excused absence and also reported as attendance. So you'll just continue to follow your regular policy for those children that you are expecting to receive in-person services. So I now have some updates to go over. First, just some general fiscal updates. So for the alternative payment program, an update on the contract amendments that are forthcoming. Typically we send out Budget Act amendments for any contract where there's a change within the budget that would require a contract amendment. So we still are on track to issue contract amendments in early September. For the alternative payment program, those contract amendments will incorporate the emergency childcare funding for SB 98. So that was the extension of childcare and moving emergency childcare into ongoing care. So those are allocations that we shared think about a month ago with programs, so you should have those. We are working on the allocation to pay providers at the maximum certificate until funding is exhausted for SB 98. That allocation we were hoping to get out this week or next week. It has been slightly delayed due to the wildfires and some contractors' inability to report their data. So we are hoping that we will have all contractors' data by very early next week, and we'll be able to complete those allocations next week and share the allocation with you all, just as we did with the emergency childcare, so that you have those amounts prior to receiving your contract amendment. There was also a small reduction in the Prop 64 funds per SB 74 and SB 820. Those will be incorporated into Budget Act amendments. And the last one is July and August 2020 family fees that were waived. There was funding provided for these 2 months for waiving family fees. So we will also be calculating those allocations, and we'll share them with you all. That should be next week as well. And that will also be incorporated into your Budget Act amendment. So the last update I have on allocations is regarding the provider stipends. So Virginia has already mentioned that provider stipends were reduced from 62.5 million to 31.25 million in SB 820. This allocation is also pending some data from contractors that were affected by the wildfires. So we are working on this allocation in collaboration with the Department of Social Services. We also hope to have these allocations completed, if not next week, the following week. But as long as we get that data that we are still awaiting, we are on track to inform you all of what your allocation is on that as well. And then lastly, I just want to point out that for the provider stipends, these will not be incorporated into your Budget Act amendment. This will be a payment directly to the program outside of the contract. So you should hear from your fiscal analyst soon on those allocations as well. And now back to Alana.
Hi, Andrea. Thank you. Thank you, everyone, for all your questions. Let's see how we've got about 12 minutes on the clock. So, Andrea, I'm going to ask you to step back in. There's a few questions that I think you can answer. So one of them is, what is the lesser of 100% mean in terms of the MRA reimbursement?
Okay, so the regular calculation prior to this year is reimbursement is based off of your total contract amount, reimbursable expenditures, and enrollment with an adjustment for attendance if attendance falls below 95%. This year, as I explained on one of the slides, that we're not taking into account that enrollment piece and attendance piece. So when your contract earnings are determined within our system, we'll be looking at the lesser of your reimbursable expenses and your total contract amount. So basically the enrollment and attendance does not come into play when we're calculating. So if you have low attendance or low enrollment this year, that's not going to come into play when we determine reimbursement.
Awesome. Thank you, Andrea. And then one other quick question. Where can we find the updated allocation worksheet that won't take into account attendance day percentage?
I think maybe the question is about the calculation worksheet that the fiscal analyst, when we receive the data from the contractor, we calculate an earnings amount, and then our system produces a calculation worksheet. That calculation worksheet will look the same as it has been before. So you'll still see all of the data that you're submitting to us. You'll still see enrollment and attendance on that calculation worksheet. But in the calculation itself, we've changed the formulas so that the attendance and enrollment is not taken into account when we're determining the payment.
Okay, thank you. And Stephen, there is a question about what is sufficient for a public hearing, or maybe it is Virginia can also help answer it. So the question is specifically, is a board meeting sufficient to count for a public hearing?
Yeah, so this would be like an LEA board hearing, like a school board hearing, and I think as long as it's done during the public portion of the school board hearing, then I don't see why that wouldn't qualify.
Excellent. Stephen, there's another question that I think you can answer. Does ELCD consider, or CDE consider, state universities LEAs?
Good question, and I know that somebody could probably provide the education code reference, but I believe education code for our programs defines LEAs as school districts, county offices of education, and community college districts. So I did see a question somewhere in the chat here about a community-based organization operating on an LE or on a college campus. I didn't see whether it was a community college or say like a four-year college. The four-year college is not considered an LEA for the purposes of our programs, but community colleges are.
Excellent. Virginia, I know Steve started our presentation with this, but we are also still getting a lot of questions based off of what the new guidance that was given from the California Department of Public Education, especially about their cohort. And so can you reiterate to the group that we're still working through the guidance and we will give more updates when we have them. And that will include things like staffing and breaks and ratios. Thank you.
Yeah, happy to, Alana. Thank you. And thank you to everyone that's submitting all of these questions. These are really good food for thought for us as we work through everything on our end. So yes, we are working on the CDP, for the guidance that was released, as Steve mentioned earlier on in our webinar. We are working to clarify that because we know there are a couple of phrases in that our contractors weren't sure kind of how this interacted with Title V. You know, what the guidance around infant toddlers, staff breaks, some pieces around that. So we are working with our internal legal team to provide further clarification.
Excellent, thank you. And Virginia, can you also talk to the group about disenrollment and termination of families due to class size reductions?
Let me just unmute myself. So, so if there's, as we went through on the trailer bill slide, this is something the legislature has acknowledged as an issue. And you'll notice in SB 820, maybe I forget exactly what section it is because we don't have it up, but there was that piece where I shared how CDE had been directed to provide guidance around priority order for in-person services. That doesn't say that families should be terminated if they're not getting in-person services. It says that they should be provided with distance learning. So families should not be terminated or disenrolled because of any COVID-related group sizes or ratios. They should be offered distance learning if they're not receiving that priority for in-person care. And again, we're working on making sure that very shortly after that the bill is signed, that we can get you guidance on what those priorities are. We know that you need it now, but we're a little bound by the fact that it's not fully a law yet.
Thank you, Virginia. And Stephen, there is a question regarding LEAs and programs on LEA campuses. Can you explain why there's a difference for LEA, early learning and care programs, remaining closed and having the ability to provide all distance learning, and at the same not extended to independent agencies?
Yeah, so thanks, Alana. And we've gotten questions like this with regard to why are LEAs being kind of handled somewhat, differently from community-based organizations. And there are some reasons for the on-campus, for on-campus reasons, such as having kind of the support staff that aren't necessarily available when an LEA campus is closed. But I think, the overarching, thing I'll say is that at the Department of Education, so we don't enact the law, we've got to implement the law. So while it may not, make a ton of sense, or it may kind of be, confusing, or we're in the position where we've got to implement the law that, or the statute that the legislature passed and that the governor signed. So we're going to do our absolute best to implement that guidance in, the clearest, most reasonable way possible.
Excellent, thank you. So we just have a few more minutes left, so please go ahead and continue to submit on your question and answer so that we can capture those. And I do just want to acknowledge that folks have been chiming in on our chat box that they're having issues submitting to the Q&A text box, and that is definitely something that we will be working with our technology service division so that everybody has access to it and everybody can submit. And so assured for next week that we will make sure that everybody has their access to do so. I also just want to acknowledge that we are receiving a lot of questions in our question and answer box, and we are not able to speak to everything, and we're not able to answer everything live. A lot of them are repeated questions. Those are definitely the ones that we have brought up. And if you feel like you have not had your question submitted, we do realize that we have received it. We are looking at them. Our team is on that, and that there's only so much that we can answer unless we want to stay here for 8 hours, which, I know that we all have work to do because we all have children that we need to take care of. So with that, I'm going to pull onto our resources page, our bread and butter, if you will. So the slides for this webinar will be posted as soon as we are completed on our ELCD COVID-19 guidance website. That can be found at https://www.cde.ca.gov/SP/CD/RE/ELCD COVID-19.ASP. Again, if you have any additional questions or your question had not been answered today, please submit them either to your assigned regional consultant or to ELCD Emergency email inbox at elcdemergency@cde.ca.gov. And any questions from this webinar, anything that seems slightly confusing, please refer to the email blast that came through our listserv. You can also contact your ELCD Program Quality Implementation Office Regional Consultant, and a list of those consultants can be found at https://www.cde.ca.gov/SP/CD/CI/assignments.asp, or by phoning 916-322-6233. And with that, I will have Stephen come and close it out, and we are at 11 o'clock on the dot.
Wonderful. Thank you, Alana. Thank you, team. And thank you, everybody, for joining us. So on behalf of all of us, and the team at CDE is continuously working to give you the best information at a time when information is rapidly changing. We thank you for taking the time out of your day to listen to this morning's webinar, and we hope you'll join us for the next one. Take care, be safe, and be kind.